Guten Tag, meine sehr geehrten Damen und Herren, partners and friends of the German Consulate General in New York, ladies and gentlemen, dear science and research community. My name is David Gill. I'm the German Consul General here in New York, and I'm delighted to welcome all of you for today's conference on sustainable mega cities, health, risks, resources, organized by the German Center for Research and Innovation in cooperation with the great universities of Cologne, Freiburg, and Heidelberg. And it is a special privilege to welcome Dr. Ligia Noronha, UN Assistant Secretary General and head of the New York office of the United Nations Environment Program, who graciously agreed to share her experience and expertise with us today. As the world faces a growing set of global challenges, the impact of urbanization and climate change are perhaps the most significant illustrations of the issues at stake. Globally, about 55% of all people currently live in urban areas. And evidence shows that cities are responsible for 75% of global carbon dioxide emission, with transport and buildings being among the largest contributors. Moreover, cities have been at the epicenter of the COVID-19 pandemic, with 95% of cases found in urban areas. By 2050, more than 2/3 of the world's population are projected to live in urban areas. Ensuring that these urban areas will be inclusive, safe, sustainable, and resilient is therefore an urgent priority. Germany firmly believes that no country can come to grips with such challenges on its own. International cooperation and science diplomacy is a priority of Germany's foreign policy. Our aim is to create synergies at the interface of science, government, economy, and civil society, where a greater scientific voice could both add value to inclusive discussions, as well as ensure evidence-based policy making at all levels. Among our endeavors to promote science diplomacy are the German Centers for Research and Innovation. We call it DWIH in German. The altogether 5 offices are located in urban centers and hubs in New York, of course, New Delhi, Tokyo, Sao Paulo, and Moscow. A 6th office will open in San Francisco soon. Together with its member organizations, these centers seek to deepen exchange and collaboration across disciplines and borders. It is only by combining our forces that we can obtain the necessary clout and resources to help shape the world of the future. Enabling people and their governments to plan for, build, and manage the challenges of sustainable megacities is crucial. Together, I'm confident that we can lay the foundations for a cleaner, safer, and fairer world for all and for generations to come. I'm looking forward to a very interesting discussion, and I want to welcome all of you again. Thank you.
Thank you very much, Consul General David Gill, for your welcoming address. And thank you for highlighting the importance of international cooperation and science diplomacy in tackling global challenges such as now the COVID-19 pandemic, or making sure that megacities are sustainable, inclusive, and resilient, which is our topic today. I am Eva Bosbach, Executive Director of the University of Cologne, New York office. We are one of the co-hosts today, together with the universities of Freiburg and Heidelberg, the German Center for Research and Innovation, DWIH New York, the German Consulate General, New York, and Wunderbar together. Thank you so much for partnering with us for this series and for other events. It is always a pleasure. The universities of Cologne, Freiburg, and Heidelberg are all top-ranked German research universities that have a long tradition in research, as they were founded in the 14th and 15th century, respectively. And I am sure I can speak for all of us in saying that we share the goal that Consul General Gill mentioned, to promote international cooperation and to facilitate science diplomacy wherever we can with our activities. Part of the University of Cologne's portfolio are our offices in China, India, and here in North America, where we are celebrating its 10th anniversary this year with events like this one today. In these, we bring together our researchers with the interested public on both sides of the Atlantic and with important stakeholders, such as United Nations Assistant Secretary General Dr. Ligia Noronha with us today, to discuss topics that matter to all of us. The event today is the finale of a series after 3 spotlight events that focused on specific research from the universities of Heidelberg, Freiburg, and Cologne. Those led up to today, and if you did not get a chance to be there, I would like to invite you to watch the recordings online later. It is my privilege today to introduce our speakers to you. For the opening remarks, we are honored to be joined by Dr. Ligia Noronha, United Nations Assistant Secretary General and Head of UNEP, the United Nations Environment Program, New York office. Dr. Noronha is an economist with over 30 years of international professional experience in promoting environmental sustainability, and now as head of the UNEP New York office, providing strategic policy guidance in the context of the UN's work on sustainable development. Thank you very much, Dr. Noronha, for joining us. It is an honor. After the opening remarks, we will hear from 3 experts from the universities of Cologne and Freiburg. Frauke Kraas is professor for human geography at the University of Cologne. Her research focuses on urban and regional development, transformation processes, urban heritage, urban health, and disaster risk research in Southeast Asia and India. She is also chair of the expert network Forum for Urban Future in Southeast Asia. Dr. Carsten Butsch, also from the University of Cologne, works in the field of urban health and risks, with issues such as access to healthcare, health monitoring, and urban health risks in India and Indonesia. Dr. Butsch is also a member of the Commission on Research on Pandemics of the German Research Foundation, DFG. Finally, I would like to introduce Dr. Anna Petit-Bois from the University of Freiburg. Her research field is industrial ecology, with a focus on the environmental assessment of innovative strategies applied in cities. She's also the chair of Societal Transition and Circular Economy and was awarded the Helmut Lieth Prize for Environmental Research at the University of Freiburg. Before we turn it over to our speakers, the floor now goes to Katrin Di Paola from the DWIH New York. Thank you all for joining us.
Yeah, thank you so much, Eva, and also thank you, Consul General Gill, for the introduction of the German Center for Research and Innovation, where I'm serving as the program manager here. And together with my team, Julia, if you want to wave quickly, and Bruno, we're hosting the event with our partners. And it's always a true pleasure for us, of course, to serve as a host for such a stellar and important series, particularly on sustainable megacities, although with a little footnote, megacities and Germany, ? But be assured, we have a lot to say about that nevertheless. So it's really, for us, it's a topic that truly connects and divides globally. And we strongly believe that this, of course, will shape and continue to shape our future as it is. So it's great to be back for the 3rd installment in such a very illustrious circle of experts. And we would also like to extend our warmest welcome to all of you, wherever you might be right now and joining us from. As some of you know, the topic of megacities is very dear to our work here at the DWIH in New York. And I keep pronouncing DWIH to get you used to the German abbreviation. So at the end of the session, we expect everybody to shout DWIH in German, of course. No, but back to the series. So last year, for example, we hosted this big future forum, and we dedicated 4 full days to what we called Building Biopolis. And we had experts from both sides of the Atlantic taking a close look at concepts for making cities greener, healthier, and more sustainable. And we had sessions on, three-dimensional mobility, or there was an architect building bricks from bacteria, just to mention a few of the things that we discussed. And also for this year's Future Forum, which, and I want you to mark your calendars, will take place on October 14th and 15th as a hybrid event in Chicago. We're looking at cities in a broader context as well. And we're looking at challenges of sustainable circular economies, and of course, the involvement of us as citizens. And also we look at the effects of the pandemics on us as a global society, the ways we were before and what might come after. So challenges, new and old, as we all know, call for collaborative action, innovation, research, rethinking, and debate. And thus, I believe that they do not only offer bleak scenarios, but they also create hope and cures that potentially allow us to turn the urban crisis into maybe urban opportunities. And with an eye on Dr. Noronha, I would like to mention that, of course, the Sustainable Development Goals that were set forth by the United Nations play a very, very important role in all of the discussions that we put forth here at the DBE Hub. So I'll stop here because this is not my field of expertise and we have all the experts here, but you need to bear with me for one more minute because I'm also here to introduce you to the WebEx platform. So the technical aspects of it to ensure that you have the best viewing experience ever. So if you follow me to your left, the upper left corner, and you click on the little word that says view, you see at the very bottom, it says themes. If you click on themes, you can darken the background of your grid, which is much nicer to the eye than the gray default setting. It's a much more pleasant viewing experience here. Then, of course, you can play with your layout on the far right. And if you click on that, you can either have the grid view or you can see the presenter and the presentation if you like. Of course, the bottom is very important. If you're not speaking or have a question, please make sure that you stay on mute. And it would be fantastic, and I see a lot of videos on, if you want to turn on your video. It's also better for the presenter to see who they're talking to, basically. One icon that is extremely important, since we're not in a space where we can all see each other, is your little smiley button, the smiley icon there. Here you can leave your reactions. If you like something, or if you think something was of particular interest, you can give the thumbs up, or you can clap, or you can have a, little fountain. Exactly, I can see that. Perfect. Great, thank you. So make use of those for sure. You can also take a look who's participating today by clicking on the participants link in the lower right. And very important for our question and answers later is to use the chat function. If you would like to ask your question in person, just type Q in the chat function. And then our moderator, Amanda, will call on you so that you can ask the question. Exactly. And if you don't want to ask the question in person, please just type it in the chat and then we'll read it for you. So with that, I finally turn over the floor to Dr. Lisa Noronha, and I'm very happy to see you all. Thank you and enjoy.
Thanks very much, Catherine. Distinguished participants, I'm going to be speaking to you, but I have to warn you that the internet in this New York hotel is not very stable. So if I suddenly disappear, do not blame me. I did not expect this in New York, but it's interesting that it is happening here, which means, it can happen anywhere. But thank you very much for inviting me, and I'm delighted to be here. And as I said to the distinguished participants here before, this is not a keynote. I'm just giving you some opening remarks and really just sharing with you some ideas and the work that we are doing at UNEP. But I'm here completely in learning mode. In my previous job, which was as a director of the economy division, I was leading the work on cities. And so this, whatever you have to say is really very, very interesting for me in order to be able to also share with colleagues and to advance international cooperation. And the points that were made earlier by the Consul General is really key, because international cooperation is not, of course, just about sharing ideas, but also sharing capacities and sharing the ability to take forward many of these great ideas that we have. And so the offices that you have across the world are really a great help to enabling both the diffusion of these ideas, but also the enhancing of the capacities that are required for this. So thank you very much for all the great work that you do. And I'm particularly pleased to be in company of these great universities. And as I shared before, I have children who study in these universities or have studied there. And so I have a particular connection with both Heidelberg as well as the Freiburg University. Excuse the non-German pronunciation of the names. Let me turn to my few remarks. And as we've heard, megacities are the most vulnerable areas in the world, and they are at great risk of the three planetary crises that we speak about, whether it's climate change, biodiversity loss, or pollution. But the pressures that they create in cities are also creating a certain amount of leadership in these cities. And so let me start with a positive note. It's not all doom and gloom. There is a lot of thinking that's going on. So starting with the COVID experience in some of these megacities, it's very, very clear that the interconnections of human well-being and the environmental and social conditions are incredibly interconnected. Not only have we seen how the density of populations and the access or lack of access sometimes to the basic services has also contributed to the difficulties that a number of cities are facing at the moment from COVID. But over and above the COVID situation, which is now and at present, many of these megacities suffer from air pollution. And WHO figures indicate that more than 80% of people living in urban areas who monitor air pollution are exposed to air quality levels that exceed the WHO limits. And we all know that the urban poor are most exposed to the poor air, which leads to a number of environmental injustices. This is something that I'll be coming back to, so I wanted to put it out right in the beginning. And cities have been at the forefront of impact, but they've also been at the forefront of responses. And expectations are that we will see significant changes in the way cities organize themselves going forward. We've seen pressures to adapt to climate change, to heat waves causing health risks. But the shutdown in cities have hugely impacted livelihoods, especially in the informal sector. And these have had impacts which have gone beyond the boundaries of cities. But it's very important to go beyond the health issues that COVID has given rise to understand better, because this is a great opportunity to do that, opportunity in quotes, to understand the structural inequality and the vulnerability of urban life in many of the megacities in the development of any responses that we may have going forward. Just as earlier pandemics have deeply transformed our cities, for example, in London and in Paris due to cholera, COVID is triggering a deep rethinking of our cities. And it's really interesting to hear from you how this is happening and how this is moving forward. In the context of climate change, 700 plus cities have committed to halve emissions by 2030 and reach net zero by 2050 due to a unique collaboration of the C40 cities, ICLEI, Global Covenant of Mayors, and others. And secular approaches are very much central to these discussions, and we've already heard this being mentioned before. But the complexity of cities lies in the material flows and the resource flows and the relations and networks which create patterns of consumption and production that influence these flows, both in terms of the imports of finite material flows that come from outside the boundaries, both rural and peri-urban. And they need to be situated in this rural-urban continuum and context of resource flows, thus characterizing the relationship of cities with their supply and emission, waste peripheries, infrastructurally, but also institutionally, with a view to understand better the functioning of the flows and services, but also the relations and horizontal inequity, which is embedded in the resource production and use. If the human development journey that we're all engaged in is towards choices and freedoms, and these choices are getting narrowed because of the degrading environment, and COVID is a huge example of this, we need to address how to have these in balance. And cities indeed are beginning to show this leadership. I would ask you to have a look at the UN policy brief on COVID and cities, and I'm sure you have, which refer to 3 key areas where intensified commitments and actions are required. These are addressing inequality and development deficits, strengthening capacities of local actors and governments, but also pursuing a gender-sensitive, resilient, and inclusive green recovery. And that's where we've been very much engaged. Now, let me turn to UNEP's work on cities, which is totally aligned with this thinking, and is very much normative and operational. Its work is anchored in the science of policy making. And you talk of science diplomacy, and that's very much in many ways, but perhaps my role here to take forward the issue of science and the importance of actions in science. And so we have the International Resource Panel, and Germany has been very involved in the International Resource Panel, and we have the Weight of Cities report, which has influenced a lot of the thinking of the work that we do in cities. It's also influenced by the conviction that people need to be at the center of thinking, planning, and action if cities are to be livable and provisioning, and not extractive of people, environment, and resources. For this to be actioned, material flows, be it energy, water, food, waste, buildings, land, need to be directed to ensure more sustainable socio-ecological systems that are inclusive, restorative, innovative, and circular to enable a greater social cohesion, vibrancy, and community resilience. And this has come from the IRP. Our work is designed, and thank you very much for referring to it, are designed to address the SDGs. Most importantly, SDG 3, SDG 7 on energy, SDG 11 on sustainable cities, SDG 12 on sustainable consumption and production, SDG 10, SDG 16, and SDG 17, which is on means of implementation and partnerships. So UNEP supports integrated solutions. We've been looking at what we call the 3Ds, decarbonizing, dematerializing, and de-polluting, but also restoring and regenerating. So it's a 3Ds and E that comprise our work. And operationally, the strategic integration of issues and clusters are a useful way to deliver collaboratively on multiple benefits of action to different stakeholders, to address the root causes and drivers, manage trade-offs, and enable scaling up. Let me now turn to our work more specifically with regard to these cities. So along with WHO and the Climate and Clean Air Coalition, we have the Breathe Life campaign, which involves 70 cities and over 486 million citizens, which seeks to commit governments, national, region, and local, to WHO air quality guidelines by 2030. It's not easy, but we're trying. We're trying to connect cities through this platform to increase the monitoring of air quality, to build awareness, and to accelerate solutions, as well as empower individuals to act by bringing about or highlighting the link between poor air and health, and thereby creating a certain demand for cleaner air in the cities that they work. Because it's very clear that unless we have this political momentum and the voice of citizens, sometimes action doesn't happen. UNEP is also implementing what's called the Urban Shift, which is a global program that serves as the umbrella of the urban portfolio of the Global Environmental Facility. This is an integrated urban portfolio with an allocation of roughly $147 million, but is bringing in roughly $2 billion in co-financing from 9 countries. And UNEP, together with partners, is providing technical support to a range of city priorities, from achieving energy efficiency to buildings to transport. You mentioned these before, Consul, urban food systems, management of municipal waste, to utilization of green spaces, infrastructure, and nature-based solutions. We also are the Secretariat for the Global Alliance for Buildings and Construction, which was set up around the Paris Agreement in 2015, which is consolidating the work of actors and governments to inspire and catalyze climate action in the context of the building sector, which, as we know, is hugely important for the climate actions. UNEP believes also that decarbonization of the transport sector in cities is key, and we're doing a lot of work in that. And this involves for us 3 groups of interventions: avoiding transport, for example, through better city planning, a shift to more efficient modes such as walking and cycling and public transport, and of course, improving transport by introducing zero-emission electric vehicles. And this decarbonization is started, with many developed countries especially adopting roadmaps to switch to zero emissions electric mobility. But finally, there are many challenges, and the challenges that we are faced with are threefold. One is not we, but the cities. Multi-level governance, which is key, the use of IT and metadata in a more equitable way, and financing. Let me briefly go through these points, and then I will stop. So when we talk of multi-level governance, it's because when you look at cities can be both vertically integrated, or the actions can be vertically integrated, but you also have a number of ways in which the horizontal integration that is required at the sectoral level need to be connected with national and regional policy making, because otherwise it becomes extremely difficult for the city to be able to carry the work to its fullest extent. And sometimes in these folds between the national, the regional, and the city come a lot of difficulties, which from both political as well as institutional ways need to be addressed. And there are examples from waste, there are examples from circular economy, there are examples from transport, all which highlight these challenges to multi-level governance. On the technology and biases, we know very well how important technology has been, and you see evidence of this right now to addressing COVID. And if you turn to our Science Technology Forum, which was held yesterday, you will hear some of the very interesting ideas of how this has moved forward. So while we see that technology has been very important, while we see that technologies, digital technologies, for example, are being used for smart cities in countries like India, for example, we do recognize that the concept of smart cities currently discussed in many parts of the world focus more on efficiency and perhaps less on inclusiveness and sustainability. And so we would very much like much more of that to be brought in the context of the discussion of smart cities. And data reveals the nature, extent, and direction of resource and material flows, and therefore it's very important for redesigning or rethinking resource allocations and resource use. And the relationships between the citizen and the state become very important in the context of the delivery of basic services. Who benefits, who loses as a result of these resource flows? But resource data can also be powerful drivers of reconfiguration of institutions to serve the public good, but they can also be difficult and complicated. And that's why it's very important to keep that in mind, perhaps for us in the UN when we go forward. And so we know that while there are major knowledge and assessments which are taking place, but there are also major knowledge and assessment gaps which remain with regard to digitalization and other related frontier technologies. On the financing levels, we find three key issues at the cities, for the cities. One is, in order to unlock the so-called trillions of dollars of investment in sustainable pathways, we need to facilitate the city's access to financing. And what we do find is that there is need for capacity building to allow local governments to structure projects, but also develop a pipeline of bankable projects. I know GIZ, for example, is very involved in this work, and that's really good to hear in a number of countries. But there is need also to revise frameworks, legal and institutional, to promote responsible borrowing and increase investor and financial institutions' familiarity with innovative solutions to deliver on this. Furthermore, we feel the need for enhancing the ability of local governments to be able to access the green climate funds, and again, to be able to use them through these bankable projects. And finally, the use of local governments' own funds, complemented by active participation of local and regional governments in the formulation of their own national climate investment plans. We find that one of the most overlooked and underfunded costs that have enormous impact on project success is the upstream development process, including demand assessments, community engagement, and partnership development up to pre-feasibility. Local governments often lack capacity and the data to be able to do this. But finally, let me end this intervention by stating that we have enormous belief that cities, given the agglomeration benefits that drive innovation, job creation, and business development, are central to create solutions for sustainability, efficiency, and equity. And so for us, partnerships with the national and subnational administration and non-state actors is key to the international cooperation that we all seek. Thank you very much.
Thank you, Dr. Noronha, for your remarks. It was definitely interesting to learn more about the UNEP and work towards achieving, how the work towards achieving SDGs dovetails with working towards healthier and more sustainable cities, in particular, something with which our researchers are all involved. So to shift to our researchers now, we have invited each of them as an introduction to share 3 photos to summarize ideas and information from their research, which they had shared in previous Spotlight talks. And we will start with Frauke Kraas.
Okay. Es ist Assistant Secretary General UNEP, Dr. Lydia Noronha, the Consul General David Gill. Ladies and gentlemen, I thank very much the VIH and the organizers for this great invitation to bring us all together. Thank you very much also for the great introduction. Actually, now shifting to 3 slides, I would like to bring a little bit more a combination of a situation and a key message. While looking at this picture, a gloomy day in Yangon, Myanmar, monsoon time, I was driving my children to school. The water was getting higher the longer we stood in the traffic jam. Finally, I did not dare to drive anymore. The engine of another car burst into flames. A few minutes later, I left our car at the roadside and we walked the rest of the distance to school. Better trudged through the Brownsville. Later, a local colleague laughed at me. Come on, that's normal here, monsoon season. My point is, megacities are at risk, no doubt, and we heard that already. More than before. Land subsidence, high load of high-rise buildings, vibrating traffic, climate change. All this contributes to growing inundation. In investigating risks, I think we need a shift of perspective. What we in Cologne, in Europe, in the temperate latitudes perceive a risk or disaster is often perceived by local populations as normal, unchangeable, something to be accepted. How can these perceptions be brought together? What are suitable thresholds? When are we transgressing thresholds? We need to think about that deeper than we did in the past. The next slide, please. Almost 10 years ago, September 2011, flying from Frankfurt to Bangkok. Half an hour long before landing, we flew over the largest flood I've ever seen. The journey was to attend a conference on natural disasters taking place while the disaster was happening at the same time. Heavy discussions. We need more technology, a huge dike, loans for centuries, infrastructure projects. Engineers started dream planning a mega project for a better future, asking for billions of dollars to protect Thailand's capital from heavy losses from the flood. My point is, often risk and disaster are framed as originated from nature. But is that true? Too often it is overlooked that building megacities in delta and coastal areas is simply absurd. The huge damages that building megacities there, the huge damages are actually a result not from natural, but from human-made disasters. Humans decided to build the cities there, to invest billions on infrastructure, urbanscapes, directed in the middle of the outlet of the largest rivers. At least humans are co-creating risks, and disasters contribute substantially to their magnitude and reach. So human-made, this implies it is us to change that. But is only or mainly technology to prevent and combat the right, let alone the only solution? The third slide, please. A field excursion with 26 students from Cologne through India, Mumbai. We used the train, us ladies happily in the ladies' compartment, brimming with people. My camera at hand to record urban sites to share and discuss in later lectures. Pocket slum, between the artery of mobility on the megacity. These people are living there. They are working, walking, learning. They have their local market, as we can see. Everything. They are lacking income opportunities, education, access to healthcare, clean water, toilets, privacy. What they have in abundance is noise, waste, safety issues. Not only, but also that. My point is, not just megacities, but people are at risk. We need a third shift of perspective. People, many in wide diversity, are exposed not just to one risk or a disaster. There are multiple risks, too often simultaneously, sometimes escalating, sometimes even cascading. In the past, single risks and disasters have been in the focus. Nowadays, multiple risk management is the order of the day. To prepare better, thinking in multiple threat situations flexibly, with deep understanding of the diversity of people in megacities, their particular knowledge and skills, their languages, their values, this we need to understand much better than in the past. To come to an end, yes, megacities are at risk, at multiple risks, often cascading, something to think about much more than we did until now. Thank you very much.
Thank you, Frauke. And now we hear from Carsten Butsch.
Yes, dear audience, thank you for the chance to present here some thoughts on urban health. When I was asked to present 3 pictures and deliver 3 key messages related to that, I glanced through my photo library, and I took this as a first picture because it shows something everybody who has been to mega cities in the global south sees at every corner. I think this picture actually quite nicely illustrates disparities, and these disparities are actually translating into not only health inequalities, as we just heard from Ms. Noronha, but also to health inequities. And health inequities is a term we use as health researchers, which actually shows that health differences are unfair or unjust. And when you look at this picture, it's not that the life realities of these people are completely different, but they also live in completely different, what we call epidemiological worlds. While you can imagine that the people in the front lack access to safe water and therefore suffer from gastrointestinal diseases, this will be, if you look at the background in where people can afford filtered water or bottled water, they have completely different problems. And the aspect that was raised by Ms. Noronha on air pollution, actually the people who live here in the forefront, for example, they are not only exposed much more to outdoor pollution because they have no air condition and stuff like that, which you would see, which would be the norm for the people who live in these housing societies in the back, but also they would have to cook their food using fuel wood or something like that, which also exposes, especially, and there we also have a gender issue, to indoor air pollution. So this is just one example how structural differences produce health inequities. And these health inequities are something which are a threat to megacities as such, because if you have large portions of a society which live under circumstances like this actually affects the health of the whole population, because diseases, for example, like COVID-19, can spread much more and can have reservoirs in populations who have no chance to protect themselves. That also holds, for example, not true for COVID-19, but if you think, for example, of tuberculosis, this is a disease which is a disease of the poor and which is highly prevalent in megacities of the global south, and which will be unless we do not secure a good access to healthcare services to all populations. The next slide, please. Okay, the next, this picture I actually took in Kolkata, and traveling to India for quite some time, I realized that in the last years, pictures like this are emerging, and also the signs for gyms are popping up much more frequently. And I read that actually as a symbol of a changing consciousness for health, and also a changing idea what a healthy body would look like and what to do. So exercising, being fit. You see here at the advertisement, it's cardio fitness, which is advertised, it's aerobics and stuff like that. So it's changing ideas of what status or what how relevant health is for everyone's life and what you have to do personally to stay fit and healthy. And that is somehow related to global discourses on health and fitnesses. that relates also, for example, to small things like wearables, like fitness trackers and stuff like that. All that is changing the health practices of people who live in cities and who are connected to these global discourses, while we have at the same time also traditional health beliefs. And that's something which I find quite interesting in these mega cities, that we have different discourses on what is health, which are intermingling. And from these global discourses and local discourses, new ideas of what health should be or how health can be sustained are emerging, which results in completely new health practices. And these I find as a researcher quite interesting. And the next and final picture from my side, please. This is a picture which I took in Pune, and this is a person who sells traditional medicines, Ayurvedic medicines. And that is also one point which I want to make here. When we look at health in megacities of the global south, we often have different systems of medicine which are practiced. And interestingly, the people who are sick and who seek care actually have very different pathways through health systems. They do not go to one doctor for one ailment and get treated, but they have different healers, doctors, and different medical systems they approach. And this is also related to their health beliefs. Now, this also causes some problems, because we can, when we talk about international policies for health and healthcare, we actually usually think about the Western medicine, and this is somehow our standard. But when we think about managing health and healthcare, we somehow need to include these traditional and alternative medical systems to somehow think about the provision of healthcare for the populations there. So that would be 3 points I think are relevant to consider when we talk about health in megacities of the global south. And with that, I hand over to the next speaker. Thank you very much for your attention.
Thank you. And now for Anna Petipois.
Thank you. Good afternoon, Consul General, Dr. Noronha, dear colleagues, dear participants. Thanks for inviting me today once again. And to close this round today, I brought you 3 highlights about resource use and the urban circular economy. My first point is that we have a problem called prioritization. Cities around the world are very much aware of the environmental impacts resulting from urban life. They know that in order to achieve sustainable development goals or other policy programs at the national or urban level, they have to reduce these impacts. In order to do so, they rely on several sustainability concepts that exist out there, and some of them have become particularly popular in the past years. One of them is the circular economy. The cities around the world can see the circular economy differently, so it can take many different forms. It could either be reducing food waste, increasing electricity production, renewing or regenerating natural areas, or wasting and separating waste more. But the list is very, very long. Although cities are super enthusiastic about implementing all of these strategies, it is almost impossible for them to implement them all at once. The reason is that they have limited administrative and human resources. For this reason, they need to prioritize those strategies that actually help them effectively reduce their impact on the environment. How to do that is sometimes a mystery for cities, so they need help. The next slide, please. The solution is quite easy. We need to measure. How to put that into practice, though, is a little bit more tricky. Measuring for a city or for a practitioner could mean measuring something that they can see. Just imagine taking a measuring tape. You could go out in the street and measure something that you see. This is what happens usually with the circular economy. When people want to know how sustainable they are or how many less resources they are consuming, they measure what they see. Maybe it's less food consumption or less food waste. Maybe it's more energy produced locally, or maybe it's waste separated better. But this is only what we can see. As Dr. Noronha was saying earlier, cities are very complex systems. Everything that we consume not always is produced in the city boundaries, within the city. Supply chains are complex and international, so we rely on very large supply chains and life cycle. And this means that we cannot measure everything that we cannot see or that we can see. What does that mean? We need to measure footprints, and I am sure that most of you are familiar with the concept of the carbon footprint or the water footprint. In theory, we know what that means, but measuring that could be a little bit complicated for cities. The next slide, please. So here could be the solution. Scientists know how to measure the footprint. They have methods, they have tools, they know how to calculate that. But we as scientists tend to be in our offices. We know how to do things, but we don't know what happens on the ground most of the time. Cities do, and they are our central actors. They make things happen, and they are the ones interested in this change. They have the data and they have the expertise. So the solution is simple. Let's work together more often and more effectively. If we start working from the beginning, we can conceive strategies and prioritize them in order to reduce the environmental impacts of cities. And to close this round of presentations, I would leave you with this picture of our research group participating in a workshop with practitioners, where we actually integrate their knowledge into our research. Thank you very much.
We'll now begin our discussion with our experts. As Kathleen mentioned previously, you may type a Q into the chat to let us know that you have a question, and I will call on you to unmute yourself and ask your question. So we are looking forward to hearing from our audience as much as possible. And we will include as many questions from the audience as time allows. So in the meantime, I have a question for Professor Kress, but of course, any of our other speakers can jump in and add on as well. Which kinds of thresholds can be identified where the idea of quote unquote normal starts and turning to, or where it starts turning to above normal, and what are the consequences for the stakeholders? As you were mentioning, the idea of normal monsoons versus a disaster.
Okay, yeah, thank you very much for that question. I mean, first of all, we need thresholds. Very often people do not even think of those. So what we need is really reliable data and information about, say, previous events. Then we need to define what is above normal, say maybe 10% magnitude or length, or a high number of affected people, for instance. So what we do need is to break routines. They need to be defined. We need to identify responsible persons, funds acquired. So only if a formal procedure can start while we are trespassing a threshold, it works. So you're talking about, or you have asked about, how do we leave this perception as normal? Very often, what we find, particularly in the global south, is that many people believe in traditional kind of thinking, in ways of risks are perceived as penalties, maybe for bad deeds or wrong decisions by leaders and so forth. So for a long time, as governments have not really thought about, and people as well, how to simply deal with it, there were no solutions. So there was no understanding of how to interfere in nature or the divine system. So what we need to do is define thresholds, define find ways of how to think about what is taboo, to exchange about good examples, to turn good practices into information which people can really understand, and sometimes even turn taboos into good news. what they did in Thailand, for instance, they turned taboos to a feeling which is called sanuk, which is fun. So turning taboos to something which is fun to talk about, that's the best way to pass thresholds and then to start formal activities. I think I should leave it with this.
Sure, and if I might build on that, I'm wondering if there's a parallel to Carsten Butch's point of incorporating traditional ideas of healthcare. So I guess where did the impetus come from for shifting a taboo into something that's fun to talk about? Was that sort of a local initiative? Did that come from the outside?
Yeah, I think that Frauke would have to answer. I just wanted to add one more thing about these thresholds, because when you think about thresholds, it's also interesting to look at thresholds for different groups within a city, because we usually look at a city, and when you look, for example, I've been working, and that was actually together with Frauke, we worked in Mumbai and investigated the large flood in 2005. And we also wanted to understand a little bit the thresholds. And what was quite interesting is that we worked in one informal settlement and slum area where the houses get flooded every year in the monsoon. The people really have, every year they have their furniture destroyed and stuff like that. When you think about that from a development perspective, that means all the savings or part of the savings are gone. They have to buy new things. But no one would talk about this as a disaster. For the people, it is disastrous because it hinders actually the household's development path. But when you look at when we talk about a disaster, that's actually when it's affecting also the middle class. And that's also one other perspective which I wanted to add to thresholds. Thresholds are not the same. You cannot measure the threshold with a flood level.
Great, that's a very good point to make and for us to keep in mind. We have a question from the audience from Anna Tomas Pons. So Anna, if you'd like to unmute yourself and pose your question.
Hi, thanks. Hello, everyone, and thank you. I have a question for Dr. Butch. How should mega urban health systems be designed or could be designed to respond to the growing needs of growing populations? Thank you.
Oh, if I would have an answer to that, I would be probably getting a Nobel Prize or something like that. I think the problem is that at the moment we have two competing systems in many of these cities. And that's on the one hand, as many health systems in the global south are designed according to the primary healthcare approach, which looks at basic needs in going into communities. But especially in the fast-growing cities, these primary health systems have not been scaled up, so they are not providing enough service. That's a major problem. That's one major problem. The second one is that they usually look at infectious diseases and not at non-communicable diseases like diabetes and chronic diseases, you can say, which need a different set of care. So that's one problem. And in that vacuum, at the moment, a private health sector has emerged, which means that people have to pay. So we have these two competing systems, and I think it would you would really have to make a consequent choice and either say, okay, we have a private healthcare sector which needs some kind of regulation and which needs to be made accessible. And if you follow that market logic, it would be smart to provide insurance systems for people to access these private healthcare sector. That's one point. Or you can say we want to have that dual structure, but then one would really need heavy investment in state-run services and a large upscaling. I think these are the two strategies which have to be, from which one would have to choose, but then follow that consequently. that would be my quick answer for that.
Thank you. And we have another question from Kathleen Di Paola.
Yeah, hello. Thank you for the super inspiring thoughts that you all shared with us. And a few years ago, I had a very challenging but very inspiring conversation at Columbia University, a little further north here. And one of the deans of the School of Architecture back then said a very provocative statement. He said that extreme cities are actually the best thing that could happen to humanity, because out of extreme cities, a lot of good things, innovation, also advantages and advances came. So what would your take on this be? Because I'm also thinking, you know, there are extreme cities, but they can also be a barometer to change things and make things better and actually do have something good in them. So what do you think is good about an extreme city?
Maybe I can contribute to that. Maybe it's not an example of an extreme city, but of an extreme event, and it's the pandemic. And for example, as I was talking about resources, we have all seen that an extreme, like using a mask every day, has made people think about the need for reusing materials. So at the beginning, when we were told that we had to cover our faces, everybody was afraid of spending all of their money into, I don't know, reusable masks or single-use masks. So we started to innovate in a way. So I would agree that extremes sometimes result in some new forms of innovation or other types of even policies, I would say. But this is not a good example of extreme city, I would say.
If I may add upon that, I like your idea very much. In thinking a little bit more, how could we make situations people unfold innovative ideas? I mean, this is exactly what you mean. I'm thinking about under which circumstances people can really, I mean, governments, private sector, civil society can really come to innovative ideas. I think it's very much up to regimes. It's very much up to capacities. It's very much up to education, the openness to discuss. I'm not so confident that in many of the extreme cities, really innovative ideas will come up. Maybe because they are suppressed. Maybe people cannot speak out. People are not really used to change things. So it leads to the point that we should also think about, in order to help those ideas to emerge, we should think about frames in which governments, in which administrations, all the stakeholders could really start to bring about those innovative ideas, discuss about them openly, try them, get experiments done. So all these different kinds of, from informality to formal experiments, all these ways of trying out things, we need to talk about frames in which such innovations would be possible, would be acknowledged, and then maybe incorporated and included into something which would lead to somewhere. I'm actually not so confident that many of the cities do have such a frame, but thinking about widening that is a great idea.
If I can just quickly contribute, I think on the one hand, I'm a very positive person, so maybe contrasting a little bit Frauke. I remember Hölderlin who said, wo Gefahr ist, wächst das Rettende. So where you see danger, there's also always the rescue is emerging always. Yes, I think you see a lot of cities where we have innovations. I just discussed it this afternoon with a student of mine. She was preparing a presentation on megacities, and I told her, yeah, just don't tell it's all miserable, but also come up with positive examples. And we have these positive examples. For example, when you look at Bogota, which invented new ways of managing traffic, for example. And I think there's also, and that's a perspective which I would say is important, that we can also in the global north can learn from the global south. But yes, when I look at my own work, I actually would have to say that I saw a lot of poor people, a lot of people who live in miserable conditions. But I also saw, and that what I would say is the biggest strength which I saw is civil engagement and civil society. And that's definitely a strength from which I think a lot of innovation can potentially emerge if the structures are in a way that allows for actually unfolding the potential which is there. So the potential is there where people meet, but the question is whether we can really unfold it.
Thank you all for those perspectives. We are at time, so I'm going to pose just one more question. Both Mr. Gill and Dr. Noronha mentioned in their remarks that international cooperation is a key piece of tackling common challenges. And in each of your areas of expertise, circular economy, improving health outcomes, it could be possible to look at a city as a closed system. What role do international or global forces play in a city's success in your respective areas?
Shall I start?
Sure.
Thanks a lot. Yeah, to add upon Carsten's point, I'm also a very positive person, definitively, but maybe I'm a little bit affected by the fact that, particularly in my areas in Asia, authoritarian regimes are very much oppressing ideas. And now come to your point. What kind of contributions can we as internationals bring in? First of all, I think if we move ourselves towards a deeper understanding of the local context, the local people, if we really start understanding each other, what the backgrounds are and what kind of limitations, but also what kind of options do we have. I think this is something where we as internationals can always foster an exchange. The second point is in education and capacity enhancement. Very often we see that people very much are kind of bound in their experience and do not really open much their view towards innovative, unusual ways of thinking differently. This kind of process of thinking differently is something which we can bring in through mobility, through conferences, different formats, all these alike, in encouraging each other to exchange much more on that. And the third thing I would like to take up is on science diplomacy. Particularly in the last years, and this goes back to authoritarian regimes as well, particularly in the last years, I think it is more than ever our duty as scientists to demand that we can speak openly, that we can exchange openly, and not too much look into non-interference, political correctness. So I think we should very much insist on science to be open and free and not to be tolerant in different directions. And I think this, in this point, we as scientists have a very clear role in science diplomacy. Thanks.
Can I just continue so we stay in the same order? Okay. Well, quickly, what is the effect of global issues on health? I think when we think about the pandemic, it's clear that there are strong influences. That's the obvious one. The other thing which I wanted to mention is that global lifestyles are changing somewhat. And that's another point which is affecting health in cities. And I think the traveling of knowledge and ideas, especially, and that's also a positive learning, I would say, from the COVID-19 experience, that we have that exchange, and through that exchange it was possible to understand what is going on globally, and that vaccines are starting to become available globally. They are not available globally everywhere. That's also one of the inequities we have at the moment. But yes, health is very much a global thing, which I think has been illustrated by the pandemic. Although solutions will have to be found locally, especially for health financing. I think that's really a large issue. But I wanted to strengthen one point which Frauke made, and that's the researcher as an outsider, as a catalyst, who can say where things could be changed. Researchers can be change agent, and I think that's very much related to my own experience when I worked on urban health, and I did my PhD 10 years ago. When I started with the fieldwork, I was asked, why are you working on urban health? Go to the rural areas. That's where the problems are. And that's what one expert told me whom I interviewed. And at the same person at a workshop, at a concluding workshop for my PhD, I invited him and we presented the results, and he said, I really learned something today. I've been living in the city, practicing as a medical doctor for 30 years, but I did not understand the problem of urban health. And I think that's really a point we can have as researchers. And that's not about going there and teaching, but maybe as an outsider asking different questions and asking structures or questioning structures which are established. I think that's the role which we can have, and for which a global science and an open science is really needed.
Well,
Thank you.
I can close this round then. Well, in my field, it's also very clear what the role of globalization in cities is. Basically, most of our resources, especially in the global north, don't come from the global north. So all of our supply chains are delocalized. So we depend on many other countries in order to keep our lifestyles. All of the materials, all of the food, all of the water that we consume come from somewhere else, or most of it. So, so every change that we make will have an impact on the world, and everything that we can learn from another country will be positive. But it is, as the other colleagues also mentioned, there is a distinction between different types of cities and development. So what a developing city could learn from a developed city might not be useful at this point. In other words, what I explained about the circular economy and all of these reuse strategies might not be feasible in the global south as of now, because cities are growing, and they are growing a lot, and they have to provide services to the population. So if you have to keep building buildings because people are coming to the city from the countryside, you cannot plan to reuse all of the concrete that you have in a building to produce another one. You just have to keep growing. So that means that you cannot reuse the waste or do all of these kinds of strategies. So the situations are slightly different. That's one thing that we can learn from one another. And similarly to what Frauke and Carsten mentioned, we as researchers also play a very important role, as not only as educators, but also as observers. Especially in my field, we tend to be a little bit squarehead sometimes. I'm not an engineer, but sometimes when people develop some solutions, they expect them to be used and be affected. And this is the thing that you have to do. But then if you talk to the locals, you realize that there are other things you should have taken into account. So that makes us learners as well, and also educators when people sometimes delegations come to Freiburg to visit specific projects because this is a green city. So they want to learn what kind of strategies they have implemented, how the urban greening is working. So this is the other side of the coin. We as learners and educators, I would say.
Thank you all. I think that's a lovely note to end on, and we can certainly in this group all get behind the ideas of fostering exchange and learning from one another. And with that, I turn it to my colleague, Marta Miller.
Thank you, everyone who joined us for this insightful event. We are especially thankful to our wonderful speakers, Assistant Secretary General Dr. Ligia Nerona, Dr. Frauke Kraus, Dr. Karsten Butsch, and Dr. Anna Petitbois. Thanks for sharing your expertise with us and providing a glimmer of hope regarding how we might develop more sustainable cities in the future. Thank you again to Consul General David Gill for his ongoing support of transatlantic exchange of knowledge, and to my colleagues at the DBH, University of Cologne, and Heidelberg University for their collaboration on this series. We wish you a wonderful afternoon and a good evening. So see you next time.